pace at serpent's time. I see where others stumble blind to seek a truth they never find. Eternal wisdom is my guide. I am the Doctor.
Of course, I am the Doctor. And the doctor is in. And it is time for us to check you up. It's time for you to test. It's for you to be tested. And let's get to know what is wrong with you. Why you're feeling sick. Why you're having that little headache. Or that pain over there. Or that boil. Or that pimple right there in the face. Alright, good morning. It is 20 minutes gone past the hour of 10. And it is time for another great, amazing health program, which is the Dog Talk Show, right here on yours truly, solely for your listening pleasure, Vicky Lonia Radio. And you know, I always love to bring the action. I always love to make sure that you are educated, you are informed, you are enlightened about a whole lot of things going on. And Vicky Lonia Radio is not just a radio where we just play music all the time. No, we don't just play the music theme. Yes, music is good because we love good music. Yes, but life there is more to life than music. There are other things that are really important in life. For example, your health. Your health is very much important to me as it is important to you. And that's the reason why I always go ahead to make my research, try to get new things going on out there when it comes to your health and total well-being. And that's exactly what we do right here on Dog Talk. We get to talk about your health and your total well-being. So welcome to the program today. And today's edition, the topic we're going to be looking at is great. And it's basically for the guys. But for the women, you ladies can also listen, because I know you have brothers and you have boyfriends and husbands. You might definitely want to educate them on this. Okay. And Yesterday's show was for women. Yeah, where we talked about bacterial vaginosis. Yes, I got some calls yesterday after that program. So I was like, Vicky, you're just too raw. Get ready, because today I am going to be raw too. We're going to be talking. I yabbed the ladies yesterday. I'm going to yab the guys. I'm gonna cry for my hands today. All right, once again, welcome to the show. Now, how about we bring the action?
The action.
All right, we are ready. Yes, to go ahead and bring the action. Okay, so today on Dog Talk, we are going to be looking at something that concerns the men. Okay, and the topic for today is Peyronie's disease. Peyronie's disease. Peyronie's disease. Peyronie. Peyronie. Then the is Peyronie's apostrophe S, Peyronie's disease. Now, this disease is this is actually a kind of penis disease. There are other types of diseases that affect the penis, okay? But today we are talking about Peyronie's disease, okay? It is one of the diseases that affect the penis. And the penis is that organ between the legs of a man, okay? It's what helps a man it gives him pleasure and it gives him children. And it could also give him a problem when it gets affected by one goddamn disease or the other, okay? Good. Now you're getting my point. I'm so loving today's show. All right, so let's go straight to the program proper, okay? Now, someone is going to ask me, what is Peyronie's disease? Peyronie's disease is a penis problem caused by what we call scar tissue, or called the plaque, that forms inside the penis, all right? Now, it can result to the penis being bent. Do you have a bent penis? Okay, not all bent penis are actually Peyronie's disease. When I mean the penis is bent, like it's curved, either curved downwards or curved upwards or curved sideways. Okay, after this program, you can go straight to Google and type Peyronie's disease and go to the images section so you can see what I mean by a curved dick. It could be curved left or right, up or down. Okay, now there are some guys who have curved dicks. Okay, some guys who have curved penis. Okay, but it doesn't mean that they actually have the Peyronie's disease. Okay, now it only becomes a problem when your dick is not just curved, but it's paining you. Okay, now. Look at this scenario. Look at the scenario I'm trying to paint here. I don't want you to get it wrong because this concerns you as a guy. Okay, now, it can result, when you have Peyronie's disease, there are some guys who were born with their dick curved. Okay, that's not a problem. Okay, but if your dick was straight before and then all of a sudden it begins to take some sort of shape, curve upward or curved downward or curved left or right kind of shape, you're about to, in fact, you're already having the Peyronie's disease. Now, when Peyronie's disease is a penis problem caused by scar tissue called plaque that forms inside the penis, it can result in a bent rather than straight erect penis. When your penis is erect, you notice that it is what? Curved sideways or up and down. Or up or down. Okay, good. Now, most men with Peyronie's disease can still have sex, okay? But for some, it can be painful and cause erectile dysfunction, okay? It can be painful and cause what we call erectile dysfunction, where your ability to get erect becomes a problem. Okay, good. Now, so depending on the symptoms, you may opt for observation, medical or surgical treatment. It's not all cases that require medical attention. It could be okay, but when where you begin to have pains and all that, then that is when you know that, hey, I got to visit the doctor right now. So, what exactly are the causes of Peyronie's disease? Doctors don't even know exactly why Peyronie's disease happens. Nobody knows, okay? Many researchers believe the fibrous plaque, that tissue called plaque, can start after trauma, maybe hitting or bending that causes bleeding inside the penis. You might not notice the injury or trauma on time. Okay, so for most these guys who have who have active sexual lives, who like to practice all the different sex styles, be warned, because when you constantly hit the penis or put it through much undue stress, then you're standing the chance of developing, or rather having, what we call the Peyronie's disease. Okay, now good, and in other cases, which develop over time, may be linked to genes. Maybe someone in your family before has had Peyronie's disease, your dad, your brother, or someone had Peyronie's disease in your family line, and then somehow it got to you. It skipped your brother, skipped this, skipped that brother, skipped that brother, skipped that, and now say it is you that I want to affect. Okay, so in some men, injury and genes could both be involved. Maybe when you, for example, you probably might have had an injury, in your with your dick, like maybe while you were having sex, you hit it too hard, or maybe you hit your dick. I don't know, whatever it is you were doing, and you had an injury, and then it began. You started bleeding inside, unknowingly to you, bled inside. That bleeding could cause what we call the scar tissue that results to plaque. And then when you begin to have that plaque, then trust me, you are on your way to having a very huge problem with your dick, what we call the Peyronie's disease. Okay, now, some medications list Peyronie's disease as possible side effect, but there is literally no proof that these drugs cause the condition. Some drugs, it is said that drugs could actually lead to, maybe some drugs you take could lead to Peyronie's disease, but there is no conclusion on that. Now, who gets Peyronie's disease? Although it actually most happens in middle-aged men, but younger men and older men can get it, okay? You could be a young guy, you could be an old guy, and you still get infected, or rather, you still develop the Peyronie's disease issue. Okay, so but it actually becomes more common as a man gets older. Okay, but it's not a normal part of aging. Please don't say it's because I'm getting older that's the reason why I'm having. No, that's not it. All right, that's not the point. Peyronie's disease can happen to both the young guy and the old man. Okay, do not say it's because you're getting old. It could be you're getting old could be part of the issues, but it is not the main issue. There are lots of old men who don't have Peyronie's disease. Okay, so be very careful. Now, what are the symptoms of Peyronie's disease? Now, symptoms may develop slowly or appear overnight. When the penis is soft, you can't see a problem. Okay, when you're not erect, you can't see a problem. But in severe cases, when your dick is erect, you begin to feel pain, and sometimes even when your dick is not erect, you begin to find it difficult. Usually when your penis is not erect, it is soft and flexible, right? But when you begin to develop a serious Peyronie's disease, your dick, even when it is soft, it's no longer it's not flexible. You experience excruciating pains, and even forcing the penis to bend. It will then force the penis to curve either left or right, up or down. All right, my word, I cannot even begin to imagine the pain, especially when you're erect. Oh my God, when you see a girl, you're like, damn, I'm just about to do something, and then your dick stands around and you start shouting, oh my God, she's painful. Anyways, now in most cases, the pain eases over time. As time goes on, it just goes off, but then the penis will. The bent penis will but the bend in the penis can actually worsen. Okay, even when the pain decides to ease, goes away, but your penis continues to bend and bend and bend and bend. Now, some men with the condition develop scar tissue elsewhere in the body, such as on the hand or on the foot. It could leave your penis and start affecting you in some other places. So how do doctors diagnose Peyronie's disease? So when you begin to notice stuff like this going on with your penis, run to your doctor and tell your doctor everything. Tell them the kind of sexual activities you're involved in. Maybe that could be the reason why you had the Peyronie's disease in the first place. Maybe unknown injury to the penis that caused some sort of unknown bleeding inside that led to the plague that led to the Peyronie's disease, and you had no idea. And all of a sudden, you just notice that your dick is bending one kind side, like best way get like a crippled dick, something like that. So you get an examination. Your doctor will examine you, in which your doctor will feel the tissue, will feel your dick, just try to examine the stuff. And then some guys will be like, I want a lady to be doing that. Are you serious? You're having Peyronie's disease and you're looking for a female doctor that will come and be touching your dick for you. Come on, go away, Joe. All right, let's continue with the show. We don't have much time left. So, there is a chance that you might actually get an X-ray, just to, as an ultrasound, just to see inside your dick, okay, to know what exactly is going on in there. Okay, but it's rare, but in some cases where the doctor's exam does not confirm Peyronie's disease, or if the condition develops rapidly, your doctor may do what we call a biopsy. Medical students, please help us with what the meaning of biopsy is, okay? That involves removing a little bit of tissue from the affected area for lab test. Okay, now you know what biopsy is. Okay, so can Peyronie's disease be treated? Yes, but you might not need it. Okay, since the condition improves without treatment in some men, doctors often suggest waiting 1 or 2 years or longer before they try to correct it. If after 1 or 2 years or 3 years it doesn't correct itself, nigga, you going to the surgical room right about this moment to get that dick straightened out. Okay, so what treatments are available? If you need treatment, your doctor will consider either surgery or medicine. First, your doctor will probably prescribe a pill called what we call pentoxifylline or potassium paraminobenzoate, okay? For short, potaba. All right, just so you know. Okay, so he would prescribe that for you. So all I just needed to know is that the Peyronie's disease is real and it is something that affects the men. All right, you could notice that your dick is bending either upwards or downwards, sideways, left or right. Just run to the doctor and tell him, this is what I'm going through and I need an examination right now. So now you know what a Peyronie's disease is, and you know it can affect you. So you have to live a healthy sex life. Try as much as possible not to injure your dick, and please stay with one woman and stop moving up and down. It's not a sexually transmitted disease though, so don't get me wrong. And that's why I'm going to be drawing a close right here on the program, Doc Talk. Let's do this again tomorrow. Another great, interesting topic will be coming up. All of Mr. Remains Vicky Lonia, and this is Vicky Lonia Radio, solely for your listening pleasure. Now, let's bring the action.
Bring the action.